Hari Om. Welcome to Yoga Vidya Gurukul, YogaPoint, Yoga Therapy Training Program. We will be talking about cancer from a yogic perspective. We'll try to understand the yogic view about causes of cancer and how we can help, how we can support a patient suffering from cancer with some of the yogic therapeutic practices. Before we talk about cancer, it is important to understand what do you mean by health. Now, it can be said that someone who has established his consciousness in his own self, who has understood his own self, would be considered as a healthy person. More concepts of health can be a physical, psychological, emotional, and social well being, including the spiritual well being of the human being, which can be considered as health. So there are different dimensions of health. There is a physical dimension, there is a mental dimension, there is even a social dimension. So someone who is healthy at all these levels, on all these dimensions, can be considered as a healthy individual. Another concept is harmony at the Panchakosha level. So the human beings, the human body is made up of Panchakosha, five koshas, and being in harmony, being in balance at all these levels can be considered to be healthy, or even a balance at the Tridosha level is considered as health. So there are various concepts of health and being healthy. There are certain rules to be healthy, and health is always a dynamic condition, and we can always have a better health than the state of health what we have right now. So there are some rules to improve your health, to have a better health, to increase the state of the betterment of our health. So the first rule would be regularity. Regularity in everything. Regularity in diet, regularity in exercise, in a sleeping pattern, in your behavioral pattern. So basically, having a regular lifestyle is very, very important to keep yourselves healthy. The next important thing is to have everything in moderation and balance. Everything in balance. Balanced food, balanced exercise, balanced emotions, and also it should be in moderation. Of course, diet has an important role to keep yourselves healthy. So, a good nourishing diet is very, very important. Then, the more you are in alignment with the nature, The more you go towards the nature, it keeps you healthy. Detachment from nature is one of the reasons for ill health. So, the more you come in proximity with the nature, would keep you healthy. Also, company of good people is one of the factors which can keep you healthy, because good company would be good thoughts in your mind, and good thoughts, positive thoughts, are important for health. The next factor which can keep you healthy is observing yourselves and always analyzing and evaluating yourselves. Analyze and evaluate yourselves. Find out what is wrong, what is right, and how you can improve. So, self observation is very, very important. And always think beyond I, myself, my, and mine. Selfishness can be the reason for ill health. So try to think beyond I and myself. So these are the some rules for achieving better health. After understanding some concepts of health and the factors which can improve our health, let us try to understand the types of diseases. Mainly, it can be considered that there are two types of diseases: the interactional diseases and the intrinsic diseases. Now, the interactional diseases are because of unfavorable interaction between the man and his environmental factors. These diseases are caused because of exposure to some risk factors. Now, actually, the interactional diseases, they are preventable, or we can control these diseases by improving our immunity, by avoiding exposure to the risk factors, by creating a balance between ourselves and the environment. So more or less these diseases, these type of diseases, they are preventable. And the examples of these diseases are like nutritional disorders, deficiency disorders, or the infections, or even the allergic reactions. These conditions, they are preventable, they are controllable if we have a balance between the man and environment. The other type of diseases, they are the intrinsic diseases. They are like more or less pre-programmed in the human beings. So these diseases, they are not completely preventable, not completely controllable. It is as if they are inbuilt diseases in the human being, in the man who is suffering from that disease. So some diseases, like the congenital diseases or the degenerative disorders, and even development of cancer, can be considered as the intrinsic disease. Talking about diseases, talking about ill health, what are the factors which can lead to ill health? The first and the most important factor is, of course, not observing the rules for better health. So, maybe improper diet, excess of something, inconsistency in the lifestyle, being selfish, and so on. So, someone not observing or inconsistently observing the rules for better health can cause disease, can cause ill health. Aging process is another factor which can lead to diseases, or any factors which can lead to wear and tear of the body can lead to multiple diseases. Harsh changes in the environment where we cannot cope up, where we cannot have a balance between the man and the environment. So, such kind of environmental changes can cause diseases. These changes can be natural or they can be even man made. So, man made environmental changes or natural environmental changes is one of the major reasons for ill health. And in the end, it can be the fruits of your karma, past karma, which can lead to some diseases. When there is no known cause, when you cannot find any cause for the disease, and still the person is having that disease, it can be the effect of his or her past karma, past actions. Now, talking in particular about cancer, cancer cells. Everyone knows that cancer is an abnormal mutation and multiplication of cells. So, the cells which are not normal, they multiply, and this multiplication is an unrestrained production of cells which are not normal, which are not healthy cells. Now, as the multiplication is fast and quick, these cells they do not mature and they do not perform the natural function of that particular part of that particular organ of our body. So even though the number of cells is increasing, these are not normal cells, these are not healthy cells, even they are not mature cells and cannot function in our body. Furthermore, these cells they have a invasive behavior. They can invade other parts, other tissues, other organs of our body, leading to metastasis, the spread of the cancer cell from one part of the body to another part of the body. Now, this process is going on in the human body. The normal cell, because of mutations, can give rise to the cancer cells. But someone who is having a strong immunity would destroy the cancer cells and remain healthy. But on the other hand, the cancer cells which are produced because of the mutations in someone who is having a very weak immunity would not be able to fight with the cancer cells, would not be able to destroy the cancer cells. And so the cancer cells will keep growing in number, which we call as cancer. So a normal cell, because of mutation, can give rise to the cancer cells. But it depends on our immunity if we are going to destroy the cancer cell or the cancer cell is going to multiply in our body. So basically, depending on the immunity, it will decide that even after the birth of the cancer cell, whether we are going to remain healthy or whether we are going to suffer from cancer. There are some symptoms, important symptoms, which can be early indications of some cancerous changes in our body. So, the important symptoms to be noted for early changes, early cancerous growths in our body would be changes in the bowel or bladder habit with no reasons, or unnecessary abnormal bleeding from anywhere of the body, ulcerations, unexplained weight loss, any swelling, lump in our body, difficulty in swallowing, indigestion, abnormally growth of warts or moles over the body, or persistent cough, change of voice, persistently change in voice. So, in a short period of time, if these changes, if these symptoms, they appear in someone, it's a sign of caution and needs to be investigated. Because these changes, these symptoms can be indication of cancerous growth, cancerous changes in our body. But on the other hand, it is important to remember that it's not always necessary that these changes are cancerous changes. Now, talking about some of the reasons, some of the causes of cancer, or even in general, the cause of disease. One of the important things is the karma, the actions. So, the current karma is under our control and it can give us immediate results, immediate fruit. Or the effects of current karma can go to the storehouse of karma. And when this karma is activated, we get the fruit, we get the results of this karma. But sometimes the fruits of this karma they remain dormant and they can be partially influenced by us. But this dormant karma, it can get activated and can give us results. And these results can be even in the future birth. So the effects of karma, the fruits of karma, they are not only limited to this birth, but they can be experienced in the coming births, in the future births also. When we talk about the Panchakoshas, the first level, the first kosha is the Annamaya kosha, the physical body. So the factors responsible for disease at the level of Annamaya kosha would be poor digestive function. It can be consuming unhealthy food. It can be intake of unhealthy polluted air and water. Infections, viral infections are known causes of cancer. Unhealthy lifestyle, inconsistency in the lifestyle, exposure to carcinogens, exposure to toxins. All these factors, they would be at the level of the physical body, the Annamaya kosha. The second level, Pranamaya kosha. Overexertions, mental and physical, are known causes of diseases. Lack of enthusiasm, lack of physical activity, too much of sedentary lifestyle, no exercise. All these factors, they lead to the failure of the energy system, prana, weakening of the prana in our body. And when the prana is weakened, it weakens our defense mechanisms, it weakens our immunity, which can lead to diseases. So, balance at the pranamaya kosha is very, very important. Third level, manomaya kosha, the mental body. At this level, wrong thoughts and behavior can lead to a negative state of mind. Negative thoughts, negative behavior consistently would weaken the fighting power, the immune system of our body. So, good thoughts, proper behavior, positive state of mind helps to strengthen the immune system and to keep ourselves away from diseases. Fourth level, the Vijnanamaya Kosha, the wisdom body. Now it's believed that memories, past memories, they have a great impact on our life, on our health. Impressions which we have got from the past births or even the past of this life can affect our health. It's the rewards of our thoughts, maybe present or past, and also the effects of past karmas, past actions. And in the end, the fifth level, Anandamaya Kosha, the body of bliss. It's a pure form of consciousness, and this pure form of consciousness is very close to the inner self, the Atman, your self being, where you need to connect yourselves to keep yourselves healthy. Because you have this inherent power of keeping yourselves healthy and keeping away from diseases. It's very, very important to connect yourselves with the Atman, the inner self, to activate the inner hidden power of healing yourselves. The inner self has a strong power of healing which needs to be activated. So, connecting with the Atman, connecting with the inner self is important. It supports to face the crisis, it supports to face the diseases and helps in healing. It's the willpower to fight and overcome diseases like cancer, which will be activated in the inner self. So, the willpower to fight and at the same time to know how much to fight and when to accept gracefully the effects of the cancerous condition. Because fighting, increasing the willpower is one part, but at some point, the patient would have to accept the toll of cancer, the effects of cancer, and this acceptance should be a willful, graceful acceptance to minimize the side effects, the adverse effects of the condition. For connecting with the self, the inner self, yoga talks about various practices, starting from the practice of asanas, different physical postures, then the breath awareness and pranayama, practice of yoga nidra, the relaxation technique, the healing technique, and then practice of antaranga yoga, the pratyahara and dharana, and also by increasing the willpower with the help of bhakti yoga and mantra yoga or the mantra japa. All these would help to connect with yourselves, and it will help to increase the willpower. It will help to channelize the energy, the inherent energy of healing, and it will improve the condition to a better health. Yoga will help to fight the side effects of cancer. It would help to overcome the fear, the anxiety, the stress, the insecurity, lack of energy because of cancer. It will help the patient to transform his mindset, to transform his attitude. Consciously, the patient would accept and witness the changes going on in the mind and body because of the cancerous conditions. It will help to increase the willpower to fight against the disease but at the same time, it would help to develop a detachment from it. Yoga practice would help to fight against the disease, to fight against the effects of the disease, but at the same time would help to teach the patient to let go with the condition. It will also help to understand when to gracefully withdraw from the fight. Yogic practices further would help in changing the gunas, the sattvika gun, the rajasic gun, and the tamasic gun. The yogic lifestyle changes in the mental attitude would help to bring in the sattvic quality, the sattvic guna, which would be essential, which would be important to fight against the cancerous conditions. Cancerous conditions can be considered as the effect of the tamasic guna. So, what are the rules of this yogic lifestyle? The first and the most important, of course, will be regularity and balance in everything you do. Regularity, balance, and moderation. Creating a positive mindset is also important. So, from the start to the end of the day, having a positive mindset, having a positive attitude would be important. Also, living in the present moment instead of talking about the past or future, regretting the past or worrying about the future. Instead of that, enjoying and living in the present moment is important. Time for relaxation, time for rejuvenation, time for recreation is very, very important. This relaxation would balance the pranic energy in the body and would help in the self healing process. And of course, one of the most important things in yogic lifestyle is living naturally. Go close to nature, spend time with nature, help the nature. It will help to overcome the disease conditions. It will help to create a positive attitude. It will help increasing the willpower. So these are some basic rules of lifestyle. We can call them basic rules of yogic lifestyle, which would help to fight the effects of cancerous conditions. Coming to the practice of yoga, now depending on the physical capacities, depending on the physical condition, various simple yogic practices simple yogic movements can be done. But there are some specific yogic practices which are recommended for the specific cancerous conditions. We'll try to have an overview of important cancerous conditions and the specific yoga practices which are recommended. For breast cancer, Gomukhasana is specifically mentioned to be having a healing effect, and the practice of Ujjayi Pranayama and focus on Anahat Chakra. For cervical cancer, Bhadrasana and Swastikasana are recommended. Nadi Shodhan Pranayam is considered to help in cervical cancer. Nasikagra Drishti, focusing on the nose tip, and focus of Mooladhara Chakra are helping with patients of cervical cancer. Patients with colon and kidney cancer are recommended to practice Swastikasana. The pranayam recommended is Nadi Shodhan, and the focus on Swadhisthana Chakra is recommended. For cancer of prostate or ovaries or even uterus, again the practice recommended is Swastikasana, Nadi Shodhan Pranayam, and focus on Swadhisthana Chakra. For stomach or liver cancers, practice of Vajrasana along with Nadi Shodhan Pranayam and focus on Manipur Chakra. For lung cancer, it's specifically the practice of Gomukhasana, practice of Pranamudra, Ujjayi Pranayam, and focusing on Anahat Chakra. For oral cancers, practice of Bhramari and Ajna Chakra focus is recommended. For cancers related with the throat, it's Ujjayi Pranayam and the practice of focusing on Vishuddhi Chakra. Furthermore, for brain cancers, it is recommended to practice Bhramari Pranayam and focusing on the Ajna Chakra. For blood cancer, it is recommended to practice Pavan Muktasana series 1, Nadi Shodhan Pranayam, and focusing on the Vishuddhi Chakra and the Ajna Chakra. For the cancer related with bones and muscles, the practice of Pavan Muktasana series 1, Ujjayi Pranayam, and focusing on Mooladhara Chakra is recommended. Daily practice of mantras, mantra japa, mantra yoga, is very, very important and having a healing effect for cancerous conditions. So early morning practice of Mahamrityunjay mantra for healing can be done 11 times. After that, the practice of Gayatri mantra for 11 times. It is for energy and creativity. Followed by the Durga Namavali, the 32 names of Goddess Durga for the removal of obstacles, is to be chanted 3 times, followed by the Shanti mantra and the universal peace prayer. So these mantras, chanting of these mantras every day, the first thing in the morning, would help healing the conditions of cancer. Other yogic practices which would be recommended is the practice of yama and niyama. Then it would be the practice of the swan principle, understanding your strengths, your weaknesses, knowing your ambitions and needs, and working accordingly, trying to improve on these, is the practice of swan principle. Also, maintaining a spiritual diary would help in creating a positive environment, a positive thought in the mind. Some points which can be included in the spiritual diary would be about the daily lifestyle, about how you included the practice of yama and niyama in your day to day life. It can be a note about following the swan principle, and of course, some aims and objectives of your life. So when these points they are considered on a daily basis in the spiritual diary, it would help to create a positive atmosphere, a positive thought in the mind. For concentration, practice of Trataka would be recommended. So the practice of Trataka can be started with Bahya Drushti, focusing on the external objects like a candle flame, the rising sun, the moon, or the stars. Then there are other types, different ways of practicing Trataka. Next would be the Bahya Antardrishti, where you first focus on the external objects, but then you focus on the internal objects. Further progressive practice would be Antardrishti, where you focus inside your body, maybe focusing on the chakras, focusing on the internal organs. That would be Antardrishti. And this Trataka practice should always be done with breath awareness. The practice of Shat Karma, cleaning the body, would help in increasing the immunity, would help in increasing the healing power. So, in any cancerous condition, of course, depending on the specific contraindications, respecting the specific contraindications, the patient can practice Jalaneti. They can also practice Vamana or the Kunjala Kriya. Lagushanka Prakshalan with a TTK variation. Here, TTK stands for Tadasan, Tiryaka Tadasan, and Katichakrasan. So, Lagushanka Prakshalan only with the practice of these three asanas, with the practice of only these three movements can be practiced. Depending on the physical capacity, physical condition of the patient, the repetition of these shatkarmas would be different for different patients. And also, individual specific contraindications are to be respected before practicing these shatkarmas. The safest pranayam to be practiced would be the Brahmari pranayam and Nadi Shodhan pranayam. Step by step, the duration of the practice can be increased. Step by step, various additional practices can be included. But at all points of practice, it is to be noted that the practice should be for the healing purpose and it should be within the limits of the patient who is practicing the yogic therapies. So, in short, this was the yogic perspective about the causes of cancer and the most important therapy part of yoga. So, at this point, we stop here. Hari Om.